It probably depends on who you're talking to. You know, we throw these terms around. There's different kinds of anxiety disorders. You know, there's generalized anxiety, and sometimes people talk about they're having an anxiety attack. Their generalized anxiety is just sort of, you know, they're just really, really anxious and afraid and feeling all of this, you know, stuff. Sometimes anxiety tends to be more focused, and they have a specific kind of phobia, or like in some post-traumatic stress kinds of things that happen. But a panic attack itself, you know, is a little more isolated to something that happens in a moment, and it, you know, it gets escalated and it gets worse, and you know, you have all these physiological symptoms, and somebody begins to, you know, fear that they're dying and going crazy, and et cetera, et cetera, et cetera. So if you're having those kinds of you know, panic attacks, the best thing to do is to, you know, would really encourage you to get some treatment. You know, psychologists treat this, psychiatrists treat this, and what I would make sure that you're doing is seeing somebody that knows what they're doing, because sometimes you go to, like, you know, some doctors and they may just give you some tranquilizers and say that's it. And no, this needs to be treated. Sometimes medicine helps. Generally, it's medicine from the antidepressant family, because sometimes these things can be secondary to you know, a biological or clinical depression. But they also need psychological and spiritual interventions as well. So how can you keep one from coming on? Well, you probably need help to do that, but you know, generally, here's the paradox for you, is you normalize it. You allow it. You say, okay, I'm getting anxious, that's fine. Sit here, feel it. Now, you're probably not going to be able to do that, but you ask me, how do you keep it from coming on? You surrender and allow it, because what makes it come on is people are, oh, I can't get anxious, and it's going to be horrible, and see, they try to over-control it, and then that makes it worse, instead of learning to breathe and learning to sort of allow it and realizing how you talk to yourself, and okay, nobody ever died of a panic attack, and etc. But ultimately, you got to get some treatment where they get into the thoughts that are causing this and the dynamics that are causing it and whatever it is. So I would go get some good help.